These ads on TV, people in hot tubs, Super Bowl, and they say men at a certain time in their life, for whatever the reason, lose sexual desire. Did that happen to all men or some men?
It happened to some men.
Is there any reason for that?
The most common reason to lose your sexual desire is a low testosterone. You start losing testosterone. And the other reason that is very common that people don't think about it is you do somebody's testosterone, the testosterone is a little bit low. And they have lost a lot of the sexual desire. If you do some regime, not everybody that comes in with that requires to leave the office with a prescription of some kind of a medication or testosterone replacement. One of the worst offenders that happens in men with the aging is to develop the gut fat, the fat around the gut. Those cells contain an enzyme, that fat around the gut, which is called the aromatase. The aromatase is an enzyme that converts male hormone into female hormone. And female hormone is going to cut down your desire for sex.
So in other words, if you lost weight in your belly...
If you lost weight, you exercise, you stop smoking, you're going to improve your desire.
If for some reason you didn't have the belly, you had trouble getting an erection, do you reckon ever someone should get medication?
Yes. Then we go to another thing, which is one is the loss of the desire and the other one is the erectile dysfunction. Erectile dysfunction, thank God for Pfizer company over there. When they come out with the Viagra, a lot of men came out of the closet because they made it very popular. So all these people that they thought that it was just a matter of aging, which in part it is, because the older you get, the higher the possibility that you may get erectile dysfunction, came out of the closet and then they started consulting with this thing. And then everything and all this treatment started for this erectile dysfunction.
Now, these medicines they take, they work all the time?
Medicines do not work all the time. As a matter of fact, when you take this thing like the Viagra, you take the Cialis, or you take the Levitra, which are the only three recommended and approved by the FDA,
right,
they inhibit one of the enzymes that diminishes a product inside the penis that causes the tumescence of the penis. So by cutting down on that chemical that cuts down on the detumescence, you're going to stay longer erect. However, they need stimulation. So if you take one of those pills and you do not have the cooperation with your wife or your girlfriend or your partner, and nothing is going to happen. You may take the pill, have a fight with your wife, you're not going to get an erection. This medication will not cause an erection. It will maintain the erection longer. And depends on which one of these medications, certain men will respond more to one on to the other ones. So some of them are going to work better than the other. They do not work all the time. You get approximately about 50 or 60% of these people are going to respond to any one of these medications. The other percentage of these people, they will not respond to this thing. Then you have intracorporeal injections, which is certain chemicals that you give in the penis, on the side of the penis. You give them the first shot in the office. You show them how to use this thing, and then they have to administer it themselves every time you want to have sex. And it's given approximately about 7 to 10 minutes before you want to have sex. You give yourself a shot, and it gives you a good erection. Depending on the amount of chemical that you're going to introduce there into the penis, that's the amount of erection that you're going to get. Usually the erection is going to last you for about 4 hours. If it lasts more than 4 hours, which is called priapism, you have to end up in the emergency room and get an injection of an antidote in order to cut down the erection and to lose the erection. There is also, similar to that medication that is used as a needle, there's also a suppository that is used in the penis. Since it's the only one, it's called the Muse, which is medicated urethral inserts for erection. And that stuff is also, they start with 125, 250, 500, and 1,000 micrograms. And depending on how bad that patient is, you go from a lower dose to a larger dose, and they usually cause an erection. They produce some kind of side effects, which is usually burning sensation, and when you ejaculate, you're going to produce a little bit of burning sensation in the vagina to your spouse.
Years ago, they used to put these like implanting devices and balloons.
We still use them, and they have been a tremendous amount of improvement in all these devices. The penile implants are back from the days of the small carry-on that was a rigid type of an implant that was almost like a rod, a silicon rod without bending. Then there was a gentleman that was called Silver. He made, Dr. Silver made a silver modification, and it was called a small carry-on silver Jonas prosthesis. And what that was a rod that you could bend it. And then after that, you started with other modifications that was a pumpable type of an implant, which the early pumps weren't that great. And it was one that you pumped at the tip of the penis, and then when you wanted to deflate it, you bent the penis in the middle rigidly, and then usually it was a cylinder within a cylinder, and it caused a transfer of the fluid from the inner cylinder to the outer cylinder, and it caused an erection. And they gave you girth, but not length. Length of the penis you're never going to get, even though that there are some of them, like the Ultra type of a penile implant, that gives you a little bit of added length, but it's usually not that much. Most of the time, with the length that you become an adult, that's the length that you're going to die with. The only thing is that it probably is going to die a little bit shorter, because you're not going to use it, you're going to lose it. If you don't have erections for a long time, your ability of having an erection are diminished. Therefore, like for example, somebody that loses the erection because of an operation like cancer of the prostate, that gives you erectile dysfunction. Those people are recommended to start as soon as you get the catheter out, to give them medication like the Viagra, like the Levitra, like the Cialis. Start them on early on, because the earlier you're going to start it with that, you're going to produce oxygenation, which is carrying the oxygen to the tissue in the penis. And that thing is going to keep the penis alive, and it's going to prevent it from getting scar tissue. Because once you get the scar tissue, it's very difficult for that thing to come back.
Is there any side effects of these drugs?
These drugs have a whole bunch of side effects. Initially, the Viagra started as a cardiac medication. They thought that it was a wonder medication because it produces dilatation of the vessels, that it was a great cardiac medication. They gave it to people with heart disease, and they were taking nitroglycerin, and some of them died. A combination of nitroglycerin in any form, patches, tablets sublingual, any one of the other, they think like they come under the isotyl, isosorbide, ismo, which is any one of those things that basically any form of nitroglycerin, nitropatch, nitropaste, is completely contraindicated to take this medication. Your blood pressure will drop abruptly 40 points systolic, and you have a massive heart attack and you die. So it's very important to make sure that you do not have that. Another thing, we make sure that the patient does not have any nitroglycerin in their possession, because if they're having sex and they get chest pain, the first thing they're going to do is they're going to reach for the nitroglycerin, and that's a deadly combination.
Does it affect vision to some degree? I heard something vaguely.
The Viagra.
Only Viagra?
Right.
What does it do?
Because what happened, it gives you the blue halos, and you see blue lights. And the Viagra does that because basically it inhibits PDE5 and PDE6, which is basically found in the eye. And by inhibiting that, it gives you the blue halos.
Is that a permanent problem?
No, it's transient, it's temporary.
So
but it's a little annoying. And it gives you a flushing of the face and dyspepsia, which is a little bit of irritation in the stomach when you're taking the Viagra. The Viagra is one of the drugs that you got to take on an empty stomach. Very important for all those people that want to take the Viagra. Make sure you have no food and no drinks in your stomach for about 1 hour or 2 hours before when you want to take it. And you take the pill, and thereafter you have to wait for another hour for this thing to work. And then you should engage in trying to get sexual intercourse. The other thing that they recommend is not to give up on the first pill. You got to take it for about between 5 and 7 times and see that this thing doesn't work before you say it really doesn't work. Because there's a lot of anxiety component. You don't know what to expect. You haven't had sex for a while. You take the pill and you figure you're going to get the tremendous erection. It's going to look like the Washington Monument. It's not going to do that. It does not cause an erection. It's going to help your natural erection. So if you get stimulation, you'll get an erection. As long as the stimulation is going to be there, the erection will be maintained.
So if you have diabetes or you have a cholesterol problem, that can also affect your erections.
Diabetes is the worst causant of the erectile dysfunction.
Well, cholesterol.
Cholesterol also. People that they're diabetic. Anybody that is diabetic over a period of 10 years, usually almost 100% of these people are going to have erectile dysfunction. It's going to cause some erectile dysfunction. High cholesterol also. Hypertension causes this problem. The medication that they utilize to treat the hypertension also are known to do, like the beta blockers. They're all known to cause erectile dysfunction.
In other words, if you keep yourself fit, good weight, do a lot of exercises on a regular basis, you have a better result on the road in everything you do. Is that right?
Definitely.